Further debate, the member for Oshawa.
Thank you, Speaker. Today, I want this Premier to hear from people in my community, to hear from my hospital and healthcare professionals. I want this Premier to stop and listen and understand that his sycophantic echo chamber of yes men are not listening to women in care fields or healthcare workers who are desperate for support to care for their patients. I wish this Premier cared about parents who are terrified that their kid will be one of the growing number of children who need to be resuscitated or ventilated, or whose surgery will be postponed because there isn't enough room or staff to care for them. This government is allowing folks to get sick and to suffer, and day after day, listening to the health minister talk about the fact they knew the surge was coming is enough to make anyone sick. How is it that they declare proudly that they anticipated this surge, but don't understand that the terrifying and deteriorating situation we find ourselves in was not the foregone conclusion that they have accepted knowingly, and I would argue, invited with complacent and complicit arms? Speaker, we are hearing terrible stories from real people. Here is a wrenching email that I received. Quote, "Hi, Jennifer. I'm sending this email because our healthcare system is falling apart. The hospital is understaffed with only half the amount of staff working. I'm currently at the hospital having a miscarriage, and I have waited 7 hours to see a doctor. This is insane, and we need to do something about this. There's people laying on the floor who have been here before I got here waiting to see a doctor. We should not have to wait this long for health care. The hospital staff shouldn't have to be under this much stress trying to provide care to sick people, short-staffed." End quote. Imagine that. It was only this past July that Lakeridge Health had to make the difficult decision to temporarily close and relocate the Bowmanville ICU in the middle of a significant staff shortage. And, Speaker, while that ICU is thankfully again operational, things are not better. Just a few days ago, the Region of Durham Paramedic Services and Lakeridge Health put out this joint statement. Quote, "Lakeridge Health's emergency departments continue to experience critical staffing shortages and high patient volumes. This is impacting overall wait times for less acute patients and increasing the time that the Region of Durham Paramedic Services is able to offload ambulances at Lakeridge Health hospitals." End quote. Speaker, hospitals are struggling with the staffing shortage and are handcuffed by Bill 124. The government is fine with them being held hostage by private nursing agencies who can demand any amount for their nurses, but the hospital isn't allowed to pay their own employees to retain them, to bargain competitive wages, or to even remotely pay them what they're worth. Breaking the system apart to privatize it is reckless, self-serving, backwardly ideological, and not what leadership looks like. What could leadership look like, Speaker? This government needs to repeal the wage-suppressing Bill 124. The government needs to work with unions and health sector stakeholders to create an effective plan to recruit, retain, and return healthcare workers and restore workers' rights to freely bargain for fair wages. That would not only be leadership, also responsible government. People are not only sick and tired of this government's bully tactics, they are sick. And this government needs to listen to the healthcare sector and the hurting public who are rightly demanding funded and supported, not-for-profit healthcare. Thank you, Speaker.